4 chest exercises you should avoid after 40 years old, and 4 that you should do. Without a doubt, chest training is one of the workouts that men in general enjoy doing the most. Not only the training itself, but when this muscle is well developed, we feel a very satisfying sensation. However, we also cannot lie. After 40 years old, some chest exercises may pose a greater risk to shoulders, elbows, and joints. And mind you, before you write in the comments that even at 60 years old you can lift the entire gym on the bench press. I am not saying that if you do these exercises, you will necessarily get injured, just making it clear that there are better alternatives as our connective tissues lose capacity. Let's start with the exercises you should avoid. Number 1, dumbbell fly. The dumbbell fly is a classic isolation exercise for the chest that many of us learned right at the beginning of our fitness journey. You lie on the bench, hold the dumbbells with arms extended above your chest, and then open your arms until you feel the stretch in your chest. But it is precisely in this moment of maximum stretch where the danger lies. When you are with your arms open and elbows slightly flexed, the shoulder joint is in an extremely vulnerable position. This is because the head of the humerus is being pulled out of the glenoid cavity, creating a situation conducive to rotator cuff injuries. You know that intense stretching sensation you feel in your chest during the fly? Another critical point is the inherent instability of the exercise. Unlike machine movements, the dumbbell fly requires you to control not only the weight, but also the trajectory of the movement in a 3-dimensional space. With neuromuscular coordination naturally reduced after 40, this represents a significant challenge to joint integrity. And it's not just the shoulder that suffers. When performing the fly with heavier loads, we dramatically increase tension on the biceps tendons and elbow ligaments, structures that are already more susceptible to inflammation with advancing age. The risk becomes even greater when we consider that many practitioners, in their eagerness to work the chest intensely, end up adopting exaggerated ranges of motion or using inappropriate loads, which enhances all the risk factors already mentioned. Exercise 2. Barbell bench press. The barbell bench press is probably the most iconic exercise in weightlifting. It's the one everyone asks, how much do you bench? But despite its popularity, it brings with it some significant risks. And I'm not even talking about you lowering the bar and not being able to raise it, because that, despite being a risk, is your error and not a problem with the exercise. The first major problem with the barbell bench press is the fixed position of the hands. When you hold a straight bar, your hands are locked in a position that is not always anatomical for your shoulders. This forces an internal rotation of the shoulders that, over time, can lead to chronic impact on the structures of the rotator cuff and the glenohumeral joint. To better understand, imagine the following. Each person has a slightly different bone structure. Some have wider shoulders, others narrower. Some have longer arms, others shorter. However, the bar does not adapt to these individual differences. It imposes a rigid trajectory that may be at odds with your body's natural biomechanics. After 40 years old, it's common to have some degree of joint wear or small muscle imbalances accumulated throughout life. The barbell bench press tends to highlight and aggravate these problems, especially when working with heavier loads. A small imbalance can cause one side of the body to take on more load than the other, increasing stress on already compromised joints. And we cannot forget the risk to the lumbar spine. Many practitioners, in an attempt to lift more weight, end up excessively arching their backs. This position can compromise the intervertebral discs, which are already naturally more dehydrated and less resilient with advancing age. Exercise 3. Pec deck. The main problem with this machine lies in the position it puts your shoulders during the exercise. With arms open and elbows flexed at 90 degrees, your shoulders are in a position of horizontal abduction combined with external rotation. This is exactly the position that most stresses the shoulder joint complex, particularly the anterior part of the joint capsule and the glenohumeral ligaments. Think of your shoulder as a ball inside a shallow shell. In the pec deck position, this ball is being forced against the anterior edge of the shell, increasing the risk of instability and compression of sensitive structures. Over time, this can lead to the development of a subacromial impingement. In other words, a painful condition in which the rotator cuff tendons are compressed against the acromion bone. What makes this exercise particularly treacherous is the false sense of security it provides. Because it's a machine, many practitioners end up using excessive loads or making abrupt movements, trusting that the equipment will protect their joints. In fact, the opposite happens. The fixed trajectory of the machine prevents your body from making the necessary micro-adjustments to accommodate your anatomical particularities. For people over 40 years old, who often already show some natural wear on cartilage and reduction in the production of synovial fluid, the natural lubricant of the joints, the repetitive stress of the peak deck can accelerate degenerative processes and trigger chronic inflammations. Exercise 4. Dips on parallel bars. Dips on parallel bars are often celebrated as one of the most effective exercises for chest development, especially the lower region. And indeed, from a mechanical point of view, they are extremely efficient. But this efficiency can come at a significant cost, especially for those who have already crossed the 40-year-old barrier. The main problem with dips is the enormous tension they place on the shoulder and elbow joints. During the movement, especially in the lower phase, your shoulders are forced into a position of extreme extension and internal rotation. This is precisely the position that most stresses the anterior part of the shoulder joint capsule and can lead to instabilities. Imagine your shoulder as a door. Dips are essentially forcing that door to open in a direction for which it was not designed to open extensively. Over time, this can loosen the hinges, that is, cause ligament laxity and joint instability. At more advanced ages, where connective tissues have already lost part of their natural elasticity, this stress can easily exceed the body's recovery capacity. The result? Chronic inflammations, accelerated cartilage wear, and, in more severe cases, rotator cuff tendon injuries. The elbows also suffer tremendously during dips. The elbow joint is subjected to intense shearing forces, especially when you use additional weight or perform the exercise to muscle failure. With aging, the triceps tendons and elbow ligaments become less resilient, increasing the risk of tendinitis and even partial ruptures. Another critical factor is that dips require considerable strength to be executed correctly. This causes many practitioners to compensate with inadequate movements, such as projecting the shoulders forward or swinging the body, which only amplifies the risks already mentioned. Bonus: plate press. You've probably seen someone at your gym holding a weight plate against their chest with both hands and pressing it forward. This is the famous plate press. And although I wasn't even going to mention this exercise because it really isn't very popular, since now and then I always end up seeing someone doing it, I needed to talk about it. The main reason it's on this list consists of its low effectiveness. Many fall into the plate press trap because they feel a burn in the chest during the exercise. But don't be fooled. This sensation is mainly due to isometric fatigue and does not necessarily indicate an efficient stimulus for hypertrophy. The central problem of the plate press is that it does not produce working force against the direction of the chest muscle fiber. To understand this, think about the direction in which your chest fibers run, from the sternum toward the humerus. An efficient exercise needs to create tension along this line. The plate press, however, generates a force perpendicular to this direction, resulting in extremely inefficient activation. In addition, the shoulder position during the plate press can create considerable stress on the glenohumeral joint, especially if you have any history of instability or impingement. With advancing age, this joint overload can easily turn into a chronic inflammation. Now yes, let's move on to the exercises you can do safely, even after 40. Exercise 1. Machine fly. If you felt a twinge of disappointment seeing the dumbbell fly on the list of exercises to avoid, I have excellent news. The machine fly is a fantastic alternative that preserves all the benefits of the original movement, eliminating virtually all the risks. The great differential of the machine fly is in the guided trajectory of the movement. Unlike dumbbells, which require you to control the weight in all directions, the machine provides a predefined trajectory that significantly reduces stress on the shoulder joint, especially in that dangerous position of maximum stretch. Most modern fly machines are designed with an arc of movement that respects the natural biomechanics of the human body. This means they allow your shoulders to move in a trajectory that follows the natural curvature of the glenohumeral joint, drastically reducing the risk of impingement or excessive stress on the rotator cuff. An additional benefit is that you can easily adjust the range of motion according to your individual limitations. Feel discomfort at the end of the movement? Simply reduce the amplitude to work within a comfortable and safe zone. Over time, as your mobility improves, you can gradually increase this amplitude. It also offers a unique advantage in terms of muscle stimulus, the resistance curve. In many machines, the resistance is greater precisely in the middle of the movement, when the chest is in its position of greatest strength. This creates a very efficient hypertrophy stimulus without compromising safety. And don't think you're limited to a single working angle. Most gyms offer fly machines in different configurations: horizontal for the middle chest, inclined for the upper portion, and even declined to emphasize the lower part. This allows you to work all regions of your chest safely and efficiently. To maximize results with the machine fly, perform an isometric hold at the point of maximum contraction. Exercise 2. Dumbbell bench press. The dumbbell bench press is the perfect substitute for the barbell bench press, offering all the benefits of a compound movement for the chest, but with a much lower risk profile, especially for those who have already passed 40 years old. The main advantage of the dumbbell bench press is in the freedom of movement it provides. Unlike the bar, which imposes a fixed trajectory, dumbbells allow your arms to move according to the natural structure of your body. This means you can find the exact angle that best adapts to your individual anatomy, drastically reducing stress on the shoulder joints. This freedom translates into a natural rotation capacity of the wrists during the movement. As you push the dumbbells up, your wrists can rotate slightly, allowing your elbows to follow a more natural and less stressful trajectory. This small detail makes a huge difference for the long-term health of your joints. Another often underestimated benefit of the dumbbell bench press is the additional stabilization work it requires. Your body needs to control not only the weight, but also the trajectory of each dumbbell independently. This results in a more comprehensive recruitment of the stabilizing muscles of the shoulder and trunk, contributing to a healthier and more balanced joint. Just like in the fly, you can also easily switch between different bench angles: flat for the middle chest, inclined for the upper portion, and declined to emphasize the lower part. Exercise 3. Cable crossover. The great differential of the cable crossover is in the constant resistance that the pulleys provide throughout the entire movement. Unlike free weight exercises, where resistance varies according to leverage, in pulleys muscle tension is maintained consistently. This means a more efficient hypertrophy stimulus, without the peaks of joint stress that can compromise your joints. A frequently underestimated aspect of the crossover is the controlled stretch it provides. In the initial position, with arms open, you get a deep stretch of the chest fibers. But, and this is crucial, under totally controllable conditions. You determine exactly how much you want to stretch, allowing you to work within your joint comfort zone. For practitioners with a history of shoulder discomfort, the crossover offers an additional advantage: the possibility of performing the movement with the elbows slightly flexed. This simple modification significantly reduces stress on the glenohumeral joint, making the exercise accessible even for those with specific limitations. And of course, we cannot ignore the variety. You can work different portions of your chest with surgical precision: high pulleys to emphasize the lower region, medium pulleys for the middle chest, and low pulleys for the upper portion. To further intensify the work without compromising safety, try isometric pauses at the point of maximum contraction. Hold the position of crossed arms for 2 seconds before returning to the stretch. Exercise 4. Push-ups. Push-ups are probably the most underestimated exercise in the weightlifting universe. Many consider them too basic or just for beginners. The great merit of push-ups is in the perfect load distribution between the different components of the movement. Your body naturally finds the most efficient and least stressful trajectory for your joints. There are no bars forcing your wrists to remain in fixed positions or machines imposing trajectories that may not be ideal for your body structure. Like other exercises we've mentioned, push-ups allow you to work different portions of the chest simply by altering hand positioning and body inclination. Push-ups with hands farther apart emphasize the middle and outer chest, while hands closer together shift part of the work to the triceps and the inner portion of the chest. Declined push-ups with feet elevated direct the stimulus to the upper portion of the chest, while inclined push-ups emphasize the lower region. A frequently ignored benefit of push-ups is the core stabilization work they provide. Throughout the movement, your abdominal and lumbar muscles work intensely to keep the body aligned. This not only strengthens your trunk, but also develops a more efficient neuromuscular connection between the core and upper limbs, something fundamental for injury prevention after 40 years old. For those looking to increase intensity without compromising safety, there are numerous progression techniques. You can add isometric pauses at the lowest point of the movement, perform push-ups on unstable surfaces, such as stability balls, or even use resistance bands over your back to increase the load. All these techniques amplify the muscle stimulus, without adding significant joint stress. If you liked this and also want to discover 4 leg exercises you shouldn't do after 40, we've left a video appearing right now on the screen. Don't miss it because number 3 in that video is extremely harmful and people keep doing it. Thank you for watching this far, and may God bless you, my friend.